Today I'll be discussing a fascinating phenomenon that has baffled scientists and medical professionals for years on end, the placebo effect. While often regarded as a mere trick of the mind, the placebo effect has revealed itself to be a powerful and complex force that challenges our understanding of the mind-body connection and the very nature of healing itself. The placebo effect refers to positive results that derive from taking an inactive drug or treatment to improve a person's mental or physical health. A classic analogy of the placebo effect is when a parent kisses a child's skinned elbow to make it feel better. On the outside, it seems as though the placebo effect is straightforward and easy to grasp. While it is true with its definition, it goes much deeper than that. To fully understand the placebo effect, it's important to understand the underlying mechanisms, psychological aspects, and its implications in healthcare. Intricate underlying mechanisms make up the complexities of the placebo effect. When we believe that a treatment or intervention will have a positive effect, the brain releases a surge of neurotransmitters that can influence various psychological processes. Some of these neurotransmitters include endorphins, dopamine, and serotonin. The release of endogenous opioids, include endorphins, is thought to play a significant role in the placebo effect. These substances bind to opioid receptors in the brain and spinal cord, leading to pain relief and positive mood effects. A 2005 study published by the Journal of Neuroscience has shown that dopamine levels increase in response to the anticipation of a positive outcome. This was shown by giving Parkinson's disease patients a placebo drug and saying that it will improve their motor performance. Overall, these are just a couple of underlying neurobiological mechanisms involved in the placebo effect. Another aspect to consider are psychological factors pertaining to how the mind works when given a placebo. Expectations and beliefs about the effectiveness of a treatment or intervention play a central role in the placebo effect. When individuals have positive expectations or beliefs that a treatment will work, they are more likely to experience improvements in their symptoms. Take the sugar pill analogy, for example. Just as a sugar pill has no active ingredients but can still lead to perceived improvements in symptoms, a placebo treatment can have a positive impact on a patient's condition even without any specific therapeutic properties. A 2017 research article by Frontiers in Psychology details an experiment conducted in which high and low expectations were examined in conjunction with placebo and nocebo responses. While a placebo gives a positive result, an inactive treatment, a nocebo gives a negative result, such as side effects or symptoms, to that inactive treatment. Researchers found that positive expectations correlated with placebo responses, while negative expectations correlated with the nocebo responses. Conditioning processes also contribute to the placebo effect. If individuals have had previous positive experiences with a particular treatment or intervention, they may develop conditioned responses that can lead to symptom improvement when they receive a placebo. For example, the mere act of taking a pill or undergoing medical procedure can trigger an anticipatory response that influences the individual experience. A 2010 journal article published by the National Library of Medicine gives examples of studies conducted by researchers that show classical conditioning can achieve a conditioned response with placebo interventions. For example, the authors of this article discuss how a conditioned response, such as amplifying the survival of mice who have lupus-like disease, can be observed by giving the mice an immunosuppressive drug along with a neutral stimulus. By slowly phasing out the drug but keeping the neutral stimulus, the mice started showing signs of improving from their disease. This study not only showed that conditional responses can occur from placebo interventions, but also showed how the placebo effect can occur in humans as well as animals. Understanding the psychological dimensions of the placebo effect is crucial for optimizing patient care and designing effective interventions. The placebo effect is deeply rooted in the medical field. Because of this, there are many healthcare implications. The biggest implications include the ethics behind using placebos and using placebo-controlled trials. The use of placebos without informed consent can undermine patient autonomy and raise concerns about deception. Patient autonomy refers to the right people have to know what treatment is being given to them. While placebos that are given without a person's knowledge show a greater health improvement, it would be against patient autonomy to not inform these patients that they are receiving a placebo. Therefore, to get around this barrier, healthcare providers are required to tell patients that certain treatment paths could use placebos. Healthcare providers must also be given verbal and written consent from patients who choose a treatment plan that potentially could use placebos. A 2008 article published by the American Family Physician Journal suggests a guideline to follow when giving someone a placebo. The guidelines include 1. Establishing a physician-patient relationship. 2. The patient has a concrete diagnosis. 3. The patient requests some form of intervention. 4. The use of the placebo is considered a last resort. And 5. The placebo does not interfere with the processes of diagnosing and treating the patient. Placebos used in clinical trials often act as the control variable. Researchers will test their new treatment and compare these results with the results from the placebo. A 2013 journal article published by the National Library of Medicine mentions the history and usefulness of placebos in clinical trials. The authors discuss how placebo-controlled clinical trials only recently become widespread after World War II. The authors of this article stated the randomized clinical trial was a major methodical breakthrough in medicine, and the best evidence for new treatment came from randomized placebo-controlled double-blind studies. The effectiveness of a new treatment can be examined in clinical trials by observing its effects on patients as well as comparing the results to that of the placebo. Overall, the placebo effect stands as a testament to the immense power of the human mind. It reminds us that healing goes beyond the physical realm and encompasses the intricate interplay between our thoughts, emotions, and physiology. By embracing and understanding the placebo effect, we open the doors to a more holistic and compassionate approach to healthcare, one that recognizes the profound influence of our minds.